What if healthcare was coordinated to ensure smooth communication between services? Our population is aging with increasingly complex healthcare needs. The current healthcare system, which is hospital-based, is finding it increasingly difficult to meet the increasing demands of today's population. This system is also very expensive. I'd like you to meet Tom. Tom is 72 years old, has a history of chronic depression, as well as type 2 diabetes, COPD, and arthritis. He has been coping fairly well with self-management healthcare strategies, but then his wife recently passed away. Tom's daughter, Diana, is concerned her father is lonely and increasingly depressed. She tries to support her father, but lives 2 hours away and has small children and a growing business. Tom frequently sees his primary care provider. He does find it difficult to discuss all his needs during his brief appointment times. If Tom can't get the help for his health concerns between appointments, he calls for an ambulance. Each time, he spends time in the emergency department and is often admitted. He sees lots of healthcare professionals and has to explain his concerns multiple times. It's so frustrating. He often has to wait for referrals and assessments by community care providers before he can be discharged from the hospital. The result, unnecessary time in hospital. And when he gets home, the lack of communication between his primary care provider, the community services, and the hospital means he often doesn't get the support he needs. Eventually, after several hospital visits over 6 months, Diana and Tom decide he will be admitted to a long-term care facility. But what if Tom's healthcare services work together to support Tom? Imagine one of his care providers was given responsibility for the coordination of Tom's care. For example, Sally, one of Tom's community mental health clinicians. Sally asks Tom if she can meet with Diana, so that Diana is aware of her involvement in Tom's care. Sally reaches out to others on Tom's care team and arranges a meeting. Sally speaks with Tom, Diana, Tom's primary care provider, and others involved in his care. Tom explains that he wants to continue living at home. Together, they develop a care plan which they all can access at any time. Tom now has regular contact with Sally, which is helping in his treatment of depression and loneliness. His care team has supported Tom to attend a local exercise group for older adults and helped him to coordinate transit to the program. On occasions when Tom does have a crisis, he contacts Sally or her alternate rather than calling for an ambulance. A couple times he has called the crisis line after hours. He feels safer knowing there is someone available to support him 24/7. This has resulted in Tom going to the hospital less frequently, and even when he is admitted, he's discharged after a review of his care plan with any necessary updates. If Tom's condition deteriorates, his team can coordinate additional supports as necessary. His care plan is jointly updated with all of Tom's circle of care, and Sally continues to coordinate communication within the care team and family. So now Tom doesn't have to be admitted to a long-term care facility, as he is getting the support he requires from his community providers. He's healthier and happier. His family is feeling better, knowing that his care needs are being met, and they can now support him more effectively. And there is better use of the resources within the healthcare system. Now let's recap on what transformed Tom's care. Sally, Tom's most responsible clinician, working with Tom's other care partners, including family, was able to develop a plan of care to support Tom's health and his desire to remain in his home. Tom reaches out to Sally or her colleagues when he is in crisis, and she is able to support him in accessing services or supports. Tom knows where to reach when he has concerns, and his care providers work together to support Tom.